Welcome to EduSoul, Learning with Heart. This channel provides content for MEd, MA education students and UGC NET aspirants. Today's topic falls under inclusive education, where we will be discussing about cerebral palsy. In this class, let's see the history, meaning, types, characteristics, identification, assessment, impact on development, educational provisions of cerebral palsy. Let's see the history of cerebral palsy. The study and understanding of cerebral palsy have evolved over time with contributions from key figures in medical history. The first one, William John Little. He was the first to clinically describe cerebral palsy in the 19th century. Initially, he believed that cerebral palsy was caused by complications during childbirth. Second, Sir William Osler, who coined the term cerebral palsy to define this condition. Third, Sigmund Freud. He provided a more complete description of cerebral palsy, suggesting that brain damage leading to cerebral palsy might occur before birth rather than just during labor. Let's see the etymology of cerebral palsy. The term cerebral palsy consists of two words, cerebral and palsy. Cerebral refers to the brain. Palsy comes from the Greek word meaning paralysis or looseness, which refers to weakness or problems with using muscles. Let's see the meaning of cerebral palsy. According to the RPWD Act 2016, cerebral palsy is defined as a group of non-progressive neurological condition affecting body movements and muscle coordination caused by damage to one or more specific areas of the brain, usually occurring before, during, or shortly after the birth. It is the result of a brain lesion which is incurable, non-progressive, not contagious, not communicable, but manageable, and it is chronic. Let's see the types of cerebral palsy. Cerebral palsy is classified into different types based on muscle control and movement patterns. They are spastic, dyskinetic, ataxic, and mixed. Let's see the spastic cerebral palsy, which is the most common type. About 70 to 80% of cerebral palsy will have spasticity. It is characterized by muscle stiffness and tightness due to damage in the premotor cortex. The affected muscles resist movement and remain contracted. So disruption in muscle movement patterns that causes certain muscles to contract all at once when you try to move or even at rest. The muscles remain contracted and resist being stretched. There are subtypes of spastic cerebral palsy. They are monoplegia, diplegia, triplegia, quadriplegia, hemiplegia, and double hemiplegia, pentaplegia, and paraplegia. Let's see some of them in the next slide. Monoplegia, which affects one limb. Diplegia, it involves muscle rigidity, primarily in the legs. The arms, however, may be impacted to a lesser extent. Hemiplegia affects one side of the body, one arm and one leg. Quadriplegia affects all four limbs and the body from the neck down. And paraplegia affects both the legs. It is the complete impairment in motor or sensory function of the lower extremities. Pentaplegia affects all four limbs and the head or neck. Let's see the second type, dyskinetic. It is caused by damage to the basal ganglia in the brain. Individuals experience involuntary movements that are difficult to control. These movements can be slow, twisting, rapid, and jerky, and can impact movement in the hands, arms, feet, legs, trunk, neck, and even the face or tongue. There are different types of movements that can be seen in dyskinetic cerebral palsy. They are chorea, athetosis, and dystonia. Chorea include irregular dance-like jerky movements. Athetosis include slow worm-like movements where muscles of face and tongue are also affected. Dystonia has simultaneous contraction of agonist and antagonist muscles that are repetitive twisting movements. And third, ataxic or ataxia. It is caused by damage to the cerebellum, which controls balance and coordination. So the damage to the nerve cells in or around the cerebellum can result in ataxia. It is an impairment of muscle control or coordination. This can affect different types of movements, including but not limited to walking, eating, talking, writing. It has uncoordinated movements in the body parts, disintegration of movements of the upper extremities when the child reaches for the objects. Let's see characteristics of cerebral palsy. People with cerebral palsy may show a variety of symptoms including rigidity and stiffness in the limbs, scoliosis, which is dislocation of the spine, drooling, where unintentional and excessive flow of saliva may occur, involuntary movements such as slow, fast, rhythmic, gait problems, clumsiness, speech and swallowing difficulties, uncontrollable eye blinking, slow reflexes, poor trunk stability, floppy limbs, poor balance and posture, poor hand-eye coordination, and impaired fine motor skills, jerky movements, and abnormal posture are the characteristics of cerebral palsy. How to identify the individuals with cerebral palsy? If an individual is having difficulty in sitting on a regular chair, or in walking, jumping, climbing without any support, or in controlling voluntary movements, or holding and placing objects and breathing while speaking, if you find any individual having difficulty in all these above mentioned things, they may be having cerebral palsy. How do we assess students or individuals when they are getting education in school? We should ensure physical access to the testing area and separate room to be provided for them and provide writer when needed. Use of assistive technology like computers, voice synthesizers, and use of communication boards for responding to questions. Modification of question types to accommodate motor difficulties. We are not supposed to test them on drawings or geometric questions. And suitable postural and sitting arrangement to be made by providing adapted chair or table. Time for answering questions should be extended. Breaks may be allowed to counter fatigue. Use of adapted devices and equipment such as pencil grippers. The papers or answer sheet provided should be thick. Let's see the impact on development. Delay in developmental milestones due to poor muscle tone, movement and coordination. Delay in speech and language development due to issues in controlling muscles. Cognitive impairments can vary, affecting learning and problem solving abilities. Challenging social interactions due to physical limitations, sensory processing issues and challenges in swallowing. These are all the impact on development. Let's see the educational provisions for children with cerebral palsy. Occupational and physical therapy so that it will improve mobility and independence. Adapted curriculum where modifications based on the child's learning needs. Extended time for assignments or exams to accommodate motor challenges. Accessible classrooms such as ramps, elevators and adapted seating arrangements. Assistive technology such as speech-to-text, communication boards and adaptive devices. Individualized educational plans that are tailored to meet specific needs of the child. Though cerebral palsy is a lifelong condition, but with early intervention, therapy and the right educational provisions, individuals with cerebral palsy can lead fulfilling and independent lives. Awareness, inclusivity and proper support systems are key in ensuring that children with cerebral palsy receive the education and care they deserve. Thank you.